Welcome to AI Book Highlights.
Hi there.
Today we're looking at a really interesting book, Dissolving Illusions, Disease, Vaccines, and Forgotten History by Suzanne Humphries and Roman Bystrianyk.
Yeah, this one definitely challenges some common assumptions about how infectious diseases declined and, well, the role vaccines played historically.
It really does. The authors use a lot of historical data to argue that maybe things like sanitation and nutrition were, much bigger factors than we tend to give them credit for.
Exactly. So we're going to walk through maybe 5 key highlights in the book, some pretty surprising historical details, and then think about what that means for how you might approach health today.
Sounds good. Let's dive into that first highlight then, the impact of, well, just basic living conditions.
Right. The book makes a really strong point that improvements in sanitation, hygiene, nutrition, less crowded living,
Mm.
these were massive drivers behind the drop in diseases like scarlet fever, typhus, cholera.
And importantly, these were diseases declining before vaccines for them were even a thing.
Precisely. Which contrasts sharply with the sort of standard narrative for diseases where vaccines did become available later on.
And the descriptions they use from the 1800s, they're pretty stark, aren't they?
Oh, absolutely. It paints a picture of squalor that's hard to imagine today. Overcrowded tenements, basically no functional sanitation, contaminated water. They quote sources talking about pestilential human rookeries.
Wow. And Southwood Smith comparing a fever patient's room to a stagnant pool, that really sticks with you.
It does. And it wasn't just the housing. The book talks about the food, too, especially for the working classes.
Yeah, like in New York, selling, what was it, unwholesome meat, rotten fish, even horrible pies.
I mean, if that's your diet, your body is already under stress, right? It
Uh-huh.
makes you so much more vulnerable to other infections.
Definitely. And then you add in the working conditions. Kids in mines, factories, long hours.
Exposed to toxins like lead, mercury, arsenic. It wasn't just about germs. It was about the overall physical state people were in, constantly weakened by their environment.
Okay, so that's a powerful argument about the foundational importance of living conditions. Let's move to the second highlight, which looks critically at the history of smallpox vaccination.
Yeah, this is often held up as the vaccine success story. But Dissolving Illusions presents a, let's say, more complicated history.
Starting right at the beginning with the origin of the vaccinia virus itself.
Right, there was actually quite a bit of uncertainty. Jenner initially thought it came from horses, something called the grease. Later, people debated if it was from cows, horses, or maybe even a modified form of smallpox.
So not quite the clear-cut cowpox story we sometimes hear, and the book mentions early experiments weren't always successful.
No, they cite a Dr. Drake in 1799, I think, who vaccinated children, but they still developed smallpox when later exposed, so effectiveness wasn't guaranteed from the start.
And there were reports, even back in the early 1800s, of vaccinated people still getting smallpox, sometimes even dying from it.
Yeah, the Medical Observer and newspapers documented cases, like a boy in Somerstown, a laborer's wife in Lambeth, examples where the vaccination clearly didn't provide complete protection.
Which leads into the point about the big smallpox epidemic in 1871-72.
Exactly. In Europe, places that were considered highly vaccinated, like Bavaria, still had severe outbreaks. And interestingly, the book notes reports that vaccinated people sometimes got sick before the unvaccinated during that epidemic.
So it suggests the narrative around smallpox vaccines' early total effectiveness might be, well, a bit oversimplified.
That's certainly the perspective the book puts forward, yeah. It prompts questions about what else was contributing to smallpox's eventual decline.
Okay, moving to the third highlight. This one's a bit unsettling. It deals with contaminated vaccines and unintended consequences.
Yeah, this is a tough part of the history. Early vaccine production, it wasn't sterile like today. They often used live animals like calves.
And those animals could be sick themselves, right?
Absolutely. The book actually links outbreaks of foot and mouth disease in the U.S. directly to vaccine manufacturing processes using infected animals. There's even a figure illustrating this.
Wow. And it wasn't just animal diseases.
No. The authors discuss historical concerns and documented instances where things like infectious hepatitis, TB, even syphilis might have been transmitted through contaminated vaccines.
Syphilis. Really?
Yeah, they cited Dr. Rickard in 1863, who apparently reluctantly admitted it was possible. It's a stark reminder of how different things were the lack of understanding and safety protocols back then.
And they give specific examples of people suffering severe reactions after compulsory vaccination.
Right, cases like Arthur Smith Jr. or Michael Rawson's daughter who had terrible skin issues and seemed mentally impaired afterward.
Yeah.
And the really tragic story of Thomas McCurry's sores, blindness, paralysis.
It's sobering. It definitely highlights the risks associated with those early cruder
A
methods.
far cry from modern vaccine production and safety standards, for sure.
Definitely. Okay, highlight number 4 brings us to Leicester, England, and a significant anti-vaccination movement there.
Yeah, the Leicester story is fascinating. It wasn't just a fringe thing. It was a major public reaction against compulsory smallpox vaccination in the late 1800s.
What triggered it? Was it related to that big epidemic we mentioned?
Partly, yes. The 1871-72 epidemic hit Leicester, despite, relatively high vaccination rates. This led a lot of people to question how effective the vaccine really was.
So they started resisting.
Big time. There were huge public demonstrations, parents outright refusing to vaccinate their kids, even facing fines or jail time. It became a major stand for conscientious objection. The book even mentions banners from different countries supporting them.
And what was the outcome in Leicester? Did they have terrible outbreaks because fewer people were vaccinated?
Well, that's the interesting part. Most infants ended up not being vaccinated, but Leicester didn't see major smallpox outbreaks in the following years. They focused heavily on sanitation and quarantine instead.
And that led some medical professionals at the time to actually question the vaccine's role.
Exactly. People like Professor Cruikshank started publicly doubting if vaccination was the sole or even primary reason for controlling smallpox, suggesting these other public health measures were perhaps more critical in Leicester's case.
Interesting. Okay, our 5th and final highlight circles back to the idea of disease decline before mass vaccination became common for other illnesses.
This uses specific data, graphs in the book actually, looking at diseases like measles and whooping cough.
What do those graphs show?
Well, for measles, you see this really dramatic drop in the death rate, both in England and the U.S., well before the vaccine was introduced widely in the late 1960s. The mortality had already fallen massively.
So the worst of the mortality was kind of already over.
In terms of death rates, yes, largely. They cite findings comparing measles deaths in Glasgow in the early 1800s versus 1960, a huge reduction pre-vaccine.
And a similar pattern for whooping cough.
Yeah, the data for England and Wales shows a pretty steady downward trend in mortality from the mid-1800s right through to the late 1970s, encompassing periods both before and after a widespread vaccination started.
So again, the book argues that other factors must have been at play.
Exactly. They suggest it comes back to those foundational things. Better nutrition, improved sanitation, general hygiene. As living standards rose, people were just better equipped to survive these infections.
And they point to doctors from that era who recognized this too.
Yes, like a Dr. Page in 1907 arguing for sanitation and hygiene to combat diphtheria, not just injections. Or Dr. Cumming in 1922 emphasizing sanitation for eliminating diphtheria. It suggests this broader view wasn't entirely absent back then either.
Okay, so we've covered these 5 key areas from dissolving illusions. Let's try and distill some actionable takeaways for you, the listener. What's the first one?
I think the first and maybe biggest takeaway is to consider a broader perspective on health. Look beyond just specific medical interventions like vaccines.
Right, remembering the huge impact of things like clean water, good food, decent housing.
Exactly. The history really underscores how fundamental those things are for public health and individual resilience. So maybe think holistically about what contributes to your health.
Makes sense. What's the second takeaway?
It's really about questioning assumptions and being willing to look at the evidence yourself. The author, Suzanne Humphries, describes her own journey of questioning things she was taught.
So it encourages a bit of critical thinking.
Yeah, don't just take things at face value. Look into the history, examine the data, consider different viewpoints. Be an active participant in understanding health issues.
Like that George Bernard Shaw quote they mention about doctors sometimes being afraid to deviate.
Something like that, yeah. The importance of independent thought.
Okay. And the third actionable takeaway.
This one is maybe about understanding the limitations of medical knowledge. The book touches on how our understanding of the immune system, for example, is still evolving.
So recognizing that science isn't always completely settled.
Right. And that interventions can sometimes have unintended consequences, especially when our understanding is incomplete. It encourages being informed, asking questions, and engaging in discussions about your health choices, but with a certain humility about what we know for sure.
Good points. It certainly encourages a thoughtful approach.
Definitely.
Well, that's been a glimpse into some of the core arguments presented in Dissolving Illusions, Disease, Vaccines, and Forgotten History. It's definitely a book that provides a lot of historical data and challenges many common narratives.
It's very dense with information and presents a perspective that really makes you pause and reconsider the history.
Absolutely. If this has piqued your interest, we really encourage you to check out the book for yourself and explore the arguments in full detail. You can find a link to purchase it right there in the description.
Thanks for tuning in.
Yes, thank you for joining us on AI Book Highlights.